Yes, we should begin. Hello, hello everyone. Hello everyone. Good evening. I'm Yash Agrawal. I'm a third pro of MBBS student from Shagadatta Medical College and Hospital. Today we have with us Dr. Sumana Ma'am, Physiology HOD of College of Medicine and Shagadatta Hospital, and we have Ipshita Prasad with us, who will be the co-host with me. Ipshita, are you there? Ipshita.
Yeah, actually, I would have very much happy if it is in the offline mode, but somehow I couldn't get the permission from the sir, and that was a very miscommunication between me and principal. Or the time was very less for communication, and it is great to see you all in the early age of your professional life. You are arranging such programs. Thank you very much for adding me in this program. Thank you. Yes.
Thank you so much, Akshita, and thank you, ma'am. Ma'am, if you can say speak few words about endometriosis.
There is a sound disturbance. This cracking sound is
Chaitanya,
coming
can
from
you
somewhere.
mute your mic?
Yeah.
है ऑनलाइन सेमिनार चल रहा है
Chaitanya, can you please mute your mic?
I have muted myself.
Chandra,
Chandra, something is there. Who's
yes. Uh, yes, sure. Ma'am, please unmute yourself and speak up. Hello. Hello, Shumana ma'am, can you please unmute yourself and speak?
okay. Actually,
Yeah.
the voice over here it is very less from your side. Okay. Good
Okay.
evening, everyone. And as I told that I'm very much happy that I became a part of this young uh, budding doctors. And as we all know, my students, the first year students, maybe not so aware of this endometriosis, and I think hope they are here. The first year students are here. How many first year students are there, Yash?
Yes, ma'am. We have almost 50 plus students.
Okay. I'm very much happy to see you. And this is endometriosis. Why endometriosis actually? This is endometriosis month, awareness month is going on. And as per statistics, 25% of Indian women are suffering from endometriosis. And it is a thin lining over the uterus, and the inflammatory uterine lining usually grows outside of the uterus, and it causes too much of pain, and sometimes at the very beginning it becomes asymptomatic, and when it becomes symptomatic it is very late, and the person should go for surgery. So the awareness behind this endometriosis is to early intervention, and we if we could take the at least with a drug or something, we can reduce the pain of the subject or the patient, and that is the intention of this endometriosis awareness. And as we
Yes,
all
ma'am.
are in medical profession, we have some responsibility towards our society to take care of this. And if we spread this message that any kind of huge bleeding or pain or infertility after marriage of 2 to 3 years, they must go for this tests or something for the gynecologist to find out really they are suffering from endometriosis or not. So now, with this short speech, I hand over to Yash and the Chaitali to move on with their program. Thank you very much.
Thank you, ma'am. Thank you so much. So, good evening, everyone. I know most of you are first year students over here, and thanks a lot for you to you all to join this seminar today. I know, this is a final year topic, this endometriosis, but as a medical student, since you entered this field, you should know as a medical student, it's your responsibility to know about this a little bit and to aware people about it. So, for you to aware people, you should be aware first about this disease, right? So, with this, I would like to start my presentation and will take you all to all the sign and symptoms. How can we diagnose it? What is the prevalence in India about it? And how can we manage this endometriosis thing? since we as a medical student should definitely know how to manage it. So you're a first year medical student, so it doesn't mean that you should not know how to manage a disease, or it will be like कि अभी हम क्या करेंगे जान के क्योंकि हम first year में. It's nothing like that. It's your enthusiasm that matters most, and secondly, it's your zeal to learn something new about anything which is happening today, and up to aware people about it, to aware the especially the women who are unaware about this disease, which is endometriosis. So with this, I'd like to start my presentation. First of all, let us know what is endometriosis is all about. So, so basically, we know that endometrium, which is present in the uterine cavity, endometrial lining, this endometrial lining is present outside of the uterine cavity, which is most commonly present in the ovary, and secondly it's present in the posterior ligament or the pelvis, or it can be present anywhere in the body. Right now, as far as we know, it can be present even inside brain, but it's not found in spleen, and rest everywhere. For example, you take lungs, you take urinary bladder, you take peritoneal lining cavity, anywhere it can be present. So imagine you guys, like if this endometrial lining is present anywhere except this uterus thing, and through this endometrial cycle, this you all know, as we all know, that after 28 days, in this 28 day of menstrual cycle, this endometrial lining shed and the bleeding occurs. So if this is present in ovary or somewhere in a contained space where the blood cannot escape, so what will happen is this blood will be contained in that space. There will be adhesion forming due to that, and immense amount of pain which we can't even imagine. So a huge respect to everyone, respect to all the women who go through this pain, and they don't even know about this sometimes. So basically, they just suffer. So we will just we all want them to be aware about it, to seek the medical professional help whenever required. So, as Shumanam, I'm told that almost 25 million of Indian women suffer from this disease, and we know that almost like most commonly it is present in the reproductive age women group, like between the age of 25 to 35-year age group of females, and 50% of women having surgery for infertility, they also go through this endometriosis, and it is almost as much as present as diabetes and asthma. But and this it is rarely found in girls before menarche, but it can be seen in young girls and teens with pelvic pain and dysmenorrhea. The main presenting feature of this disease is that there is an immense pelvic pain, and this you can distinguish it from severe other pain by like this, that the pain starts a week before the bleeding. It will continue throughout the bleeding menstrual bleeding period, and it won't be resolved. It will continue after the menstruation cycle stops. So this is an immense pain which the women go through. The exact causes is unknown, but we have several theories to prove that how this endometriosis occur, how this endometrial lining, which should be present in uterus, is present everywhere else, like lungs or ovary per se, or that there's a space between this your rectum and vagina, which is called the pouch of Douglas. So it can be present even there also. So first, so these are some of the theories which we know: metastatic theory, metaplastic theory, and induction theory. See, I'll just use some basic terms so that you can know what it is all about, this metastatic theory, this metaplastic theory, or this induction theory. So basically, this menstrual flow, this should happen in an anti-grade direction. That means that the blood should come out, right? And this endometrial lining should also come out along with it. But instead of coming forward, it moves backward like a retrograde flow. And this endometrial lining, if it goes backward, if it will trace the path, like what it comes, like fallopian tube, and then comes the ovary. So this endometrial lining will be present in the ovary, and it will get organized over there. So if it gets organized over there, so in every menstrual cycle, this endometrial lining will shed, and along with this, bleeding will happen, and this bleeding will be contained in this ovary space, and an immense pain will occur. But you can ask that, okay, this can happen, and we can see this endometrial lining in ovary and everything. But how it is supposed to be present in lungs? Like there is no direction where the from where this endometrial epithelium will be present in lungs. So we have this another theory for it, which is called metaplastic theory, by which this guys, you know that. We have this coelomic epithelium, which just differentiate into many cells. Like you must have read this in class 11, 12, this coelomic epithelium thing. So it differentiate into various type of cells. So per se, it can happen that this coelomic epithelium might get derived into some cell which it should not happen. Like it can derive into endometrial epithelium in the lungs or in the peritoneal cavity. So there, this endometrial epithelium can be present, and it has a lot of nerve endings. And as a medical student, like you'll be studying physiology this year, so you'll be knowing all about it. That the number of free nerve endings are more in an area, that will be a more sensitive area, and it will lead to an immense pain. Like the more sensitive the area is, the more pain we'll feel. So this endometrial epithelium has this more sensory nerve endings, which will cause immense pain. We have this another theory, which is called this induction theory. So it also says the thing that mesenchyme, undifferentiated mesenchyme, can transform into this endometrium tissue. So this can be present anywhere. As I told you, this endometriosis can happen in ovary, fallopian tube, as retrograde flow happens. So everywhere surrounding that area, basically the ovaries, fallopian tube, ligament that support the uterus, which is called the uterosacral ligament, posterior cul-de-sac that I told you that there's a space between uterus and rectum. There's also space between uterus and this urinary bladder, you see. This is called anterior cul-de-sac. And outer surface of uterus, the lining of the pelvic cavity. It can also be present in lungs, in the peritoneal cavity, anywhere. Intestine, rectum, bladder, vagina, cervix, vulva, abdominal surgery scar. Like this can be present in anywhere, I told you guys. So what are the risk factor for it? The risk factor can be like if you have like there is a genetic correlation with it. Since we all know like ovarian cancer, breast cancer, these all have genetic link. We all know. But this endometriosis, this also has a genetic link, which I don't think most of us know about it. So there is a 5 to 6 times higher chances that anyone, if the mother, sister, daughter, anyone has this disease, there's a high chances, 5 to 6 times chances that it is genetically associated. There is a gene associated with this disease, which is called the KRAS gene. You'll get to know about it later. But if this gene is present, so there is a high chances that it can be a hereditary disease. And if there is a great amount of exposure of estrogen during the lifetime of a woman and low body mass index, disorder of reproductive tract, and women with an abnormal uterus, this can happen over there also, and giving birth for the first time after 30 years of age. So these are the risk factors which can predispose a woman to endometriosis. Okay, so what will be the symptoms? Like what will be the women experience when she'll have this disease? She'll have an abnormal or heavy menstrual flow. Definite pelvic pain. I told you guys that this pain will start from like before 1 week of this bleeding, and it will continue throughout the menstrual cycle, and it won't resolve. Okay. And there will be a severe migraine pain, pain during micturition, pain during sexual intercourse can happen, vaginal bleeding between menstrual periods. This is also very normal. Blood in urine or from rectum, fatigue, GI problem like nausea, diarrhea, bloating, constipation. We can't even experience what a woman go through when she bleeds. Okay, so if along with this bleeding, there is immense amount of pain which is happening throughout this cycle. This is not a thing which will happen just once in a lifetime. It happens every month. So I hope you're understanding the gravity and the depth of this pain which can happen, which the woman experience and undergoes. And mostly I said that this endometriosis does it is not just limited to pain and pain during micturition, this nausea, vomiting, everything. It can also lead to fertility. So how it can lead to fertility is that I told you this ovary if there is an endometrial epithelium in this ovary, it will bleed. And what happen is this ovary get attached, like it adhere to uterus. Okay, if it gets adhere to uterus, so what happen is as we all know, this ovary release egg, which is picked up by this membrane of the fallopian tube, and through which it gets fertilized and it gets settled into the uterine cavity. But if this ovary is dislocated, if there is adhesion between this uterus and ovary, so ovary will be dislocated from its place, and the fallopian tube, this membrane, won't be able to collect this egg, which is released by ovary. So there will be no egg released in the uterine cavity, and so there will be no fertilization which will occur, which will lead to infertility in women. This is a very serious situation. If like the lady does not know, she'll come to know this diagnosis of endometriosis very late when she's trying for to get pregnant, to start his family, to start his or her family, but they won't be able to start their family. At that time, they'll come to know that the woman is experiencing from endometriosis. So if we as a medical student starts to aware people about it, tell them about what the symptoms might be, and they should seek medical advice as soon as possible, which will lead to their treatment of this disease, and which won't lead to such complication which I just mentioned, and which we can prevent this infertility thing. I hope you all are getting the depth of this thing, that if we don't diagnose this disease early, it can lead to infertility, which is a huge mental trauma to all the family which undergoes through this, and to all the women of that age. So also this endometriosis is related to ovarian cancer. The odds of having ovarian cancer is up to 2.6 times higher for women carrying genetic risk factor for endometriosis. I told you guys that this endometriosis is linked to it's linked genetically. Like there is a 5 to 6 times more chances of having this disease if your mother or if anyone in their close family in their first degree relative is suffering from this disease. Top of that, there is chances of ovarian cancer as well. So a study of genetic marker in nearly 15,000 women with endometriosis and more than 25,000 with ovarian cancer, the researcher has found that there is a link between these two conditions. So it is like the genetic link was almost like 90% of cases. In 90% of cases, it was estimated that those who have ovarian cancer and endometriosis, they are interlinked. How can we diagnose this? Okay, so if the woman is suffering from it, severe pain is happening, like she's not able to bear it, she'll come to you. And what are the symptoms by which we all get to know that, okay, she's suffering from this disease? We'll ask the symptom of the patient, whether what is the pain, like on a 1 to 10 on a scale of 1 to 10, what's the amount of pain she's suffering. She'll tell, okay, I'm suffering, like there is a control amount of pain which I can bear. And one will say, no, I can't bear this pain. It's like the pain is unbearable. So we'll classify that disease into moderate or severe case. Okay, so if there is immense amount of pain the lady is going through, taking the complete medical history of a patient. So when you guys will start what, I hope like I know in this new curriculum from first year onwards, you guys go to visit wards. So we get to know that we should take this complete history of a medical patient. We'll check for the risk factor, and there is a complete physical examination which includes the pelvic exam. And firstly, the first step of investigation which we'll do if the patient is suspected to have endometriosis or is suffering from severe pain is sonography, which is called TVS, okay, in a medical term, which you'll all guys get to know further. So this sonography, when we'll do this sonography, we'll see a cyst-like thing in this ovary. Okay, there will be a black cyst which you'll be able to see. I don't have that picture, guys, right now. But if we'll see that thing, we'll be sure of that. We'll be sure that endometriosis is like the person, that lady is suffering from endometriosis. Pelvic exam, like the pelvic examination is moderately reliable in making a diagnosis. Will have a perfectly normal pelvic exam. 47% of women will have a perfectly normal pelvic exam and still they'll be suffering from endometriosis. Okay. A pelvic exam tend to be more reliable when the patient is symptomatic or having during menstrual period. We'll do this pelvic exam, but this is more reliable when the patient is symptomatic the patient is symptomatic. What does the symptomatic word mean? Is that the patient is suffering from some symptom. I told you guys, like bleeding will happen, some nausea, vomiting, this will happen. Pain during burning, pain during micturition will happen. Pain during urinating, basically, and pain during sexual intercourse can happen. So this all symptoms, if the patient, if the lady is suffering through, then the pelvic exam will be more reliable if we'll do it that way. And what are the confirmatory diagnoses? See, there is this preliminary diagnosis which we do, by which we can know that, okay, by taking the history of a patient, by knowing, by doing the pelvic exam, okay, this by doing all this will come to know that, okay, this lady is suffering from endometriosis, but we have to confirm that diagnosis as well. So I told you that to confirm the diagnosis, the investigation of choice is ultrasound. Okay, we don't do laparoscopy. Laparoscopy is an invasive procedure. Okay. So we won't do firstly that. We'll do ultrasound. And after doing the ultrasound, we'll try to manage the patient, okay, by medical treatment, by giving them the medicine. If also the patient does not respond, the symptoms are not improving, she'll come to you and say, no, doctor, this is not improving. My pain is not improving. And I'm still experiencing all those symptoms which I was experiencing before taking the medicine. At that time, we will do this laparoscopy and we'll then diagnose it. Then we'll know, okay, this lady is suffering definitely from endometriosis, and then we will do the surgical treatment. Like we'll remove that endometrial lining, we'll remove that adhesion, which might be causing the pain, and whatever which will when we'll do this laparoscopy, we'll know the size of this growth, we'll know the location of this growth, where it is exactly. It can be anywhere. It can be in fallopian tube, it can be in ovary, it can be in anterior cul-de-sac, posterior cul-de-sac, in it can be in a ligament which support the uterine cavity. So we'll first locate the endometrial tissue and then we'll excise that tissue, we'll relieve the pain of that woman. Okay. I told you that there can be like any disease. Okay, you take any disease. It's not like that every disease is an end game. Okay, like this is a severe disease. It can't happen. Every disease has this grading that it starts from a minimal level and it goes to severe disease. Okay, this ignorance is the best thing which I'll use this word to identify this to define the stage basically. Like if the patient is aware about it, okay, endometriosis is a thing which can happen to me. So she'll seek medical help soon, and this disease won't progress to a severe condition. But if the lady is not aware about it and she'll continue suffering the pain without exactly acknowledging this disease, what will happen is this minimal disease, which was supposed to be cured as soon as possible, will transform into a severe disease. So this is what American Society of Reproductive Medicine has done, classified this disease into 4 stages. Stage 1, stage 2, stage 3, stage 4. Minimal, mild, moderate, severe. Every disease starts from a minimal level and it goes to a severe disease level. Okay. And what will happen is this endometrial tissue, I told you now, a lot amount of pain happen. There is an immense amount of pain. So it can happen is how will we know that what correlates with this pain basically? It's not the location that if it's okay, if the location of this endometrial lining is in the ovary, the pain will be more. If it's in fallopian tube, the more pain will be more. It's nothing like that. It's about this, like how much is the depth of the invasion of disease. That means if it's present in the ovary, if it's present in the fallopian tube, how much is the depth from where this endometrial epithelium has originated? Like if it's more than 5 millimeter per se, like if the depth of that disease, if the depth of this epithelium lining is more than 5 millimeter of disease, 5 millimeter in length, it will cause a immense amount of pain. It will be then categorized into moderate or severe disease. Okay. And if it's not that infiltrating, then it will be categorized into minimal and mild. So if there is less pain, there is a manageable pain, then we'll be classifying into minimal and mild. If the pain is immense, and if the pain is immense, the infiltrating length of this epithelium is more than 5 millimeter, then we'll classify into moderate and severe disease. How we determine the stage, I told you already. The extent of spread, the involvement of pelvic structure, the extent of pelvic adhesion, the blockage of pelvic tube. Okay. Depth and size of the endometrial tissue. I told you the amount, depth, and size. Okay. So how will we determine what's the mode of treatment which is required? Okay. So before prescribing anything, we should know the overall health and medical history of the patient. We should never prescribe anything to a patient without knowing their health and medical history. Their current symptoms, we should be thorough with it. The extent of the disease, the patient tolerant for specific medication, procedure, or therapies, whether she is allergic to any disease, how well she is able to tolerate that disease, tolerate that medicine, and what is the expectation of us during the treatment? Like, what will happen if we do the treatment or if we live the case like that? So, expectation for the course of the disease, if we don't do any medical intervention, how the disease is going to progress. We should be aware about it. Opinion or preference of the patient, and to know where the patient is planning to undergo pregnancy or not. So first we'll approach this disease with a non-surgical treatment option, which are this medicine treatment. Okay, the first line of treatment in almost every disease is medicine, not surgery. Will try to control the symptoms of that patient with the medicine. Okay, so firstly, this endometriosis is happening because of two reasons. First, there is increased amounts of estrogen in the women body, and secondly, due to the bleeding which is happening. Okay, so this bleeding is happening because the endometrial tissue which is present in the uterus is migrating into ovarian cavity or this ligament which is surrounding this uterine cavity. So we can stop the bleeding. We can stop we can stop this menstrual cycle. So if we stop this menstrual cycle, what will happen is this epithelium won't migrate to the ovary. So the disease will be cured. Like will be able to control the patient. Okay, so this can happen with OCP, oral contraceptive pill. If we give this oral contraceptive pill, there will be no bleeding. So if there is no bleeding, there will be no pain. Second is we can decrease the amount of estrogen in the body. We can do that by danazol, okay, and gonadotropin releasing hormone agonist. Okay, we can do this and we can create a medical menopause. Okay, this medical menopause term is used because, as we all know, this menopause occurs after 50 year of age, after 45 year of age, and medical menopause is basically the term used when the woman is menstruating in his normal reproductive age life, but we are stopping that bleeding by giving some medicine. Okay, by doing this, we'll relieve the symptom of the patient and we'll try to control the disease. Okay, but if after doing all this, we are not able to manage the disease. Okay, this is like the disease is progressing towards a moderate or a severe condition. Then we'll do a laparoscopy. Laparoscopy, as I told you, it's an invasive procedure where we'll take this laparoscope and we'll navigate through the uterine cavity and everywhere to see where this cyst is present, where this lining is present, other than uterus and the other than uterine wall, and we'll try to excise it. There is another thing called laparotomy, which is more extensive surgery, where we'll remove this displaced endometrium without damaging the healthy endometrial lining and the healthy tissue which is present. And last resort is to do an hysterectomy. Anything related to tomy means we are removing that part. Okay. So hysteric means we are removing the uterus, and tomy means removal. So we'll remove this uterus completely so that there will be no endometrial lining, there will be no migration of this endometrial lining, and we'll try to remove the disease from the lady, which to the lady who is suffering through this disease. There are alternative treatment which can be used along with the medical treatment, which is traditional medicine, nutritional approaches, homeopathy, allergy management, immune therapy. There is one theory as well that if there is low immunity in a person, in a woman, endometriosis can happen. Like endometriosis can occur also if there is low immunity. So immune therapy is given so that there is an increased immunization in the body. So I told you if the symptoms are mild, healthcare providers generally agree that no further treatment other than pain medication is necessary. So if the disease is mild, there is no adhesion, there is no risk of infertility, then we'll only try to manage the pain by pain medication. We'll give NSAIDs like painkiller, which we call it popularly, OCP, oral contraceptive pill, just to control the pain which will happen during the bleeding. So this is a very fancy term which is used for only one condition. Okay, there is an exception in medical management. Okay, what is this exception? Is this chocolate cyst? I told you guys this bleeding can happen anywhere. So if this bleeding is happening in the ovary, okay, so what will happen? That bleeding will be contained in the ovary. That blood will clot, and that will give us a chocolate appearance. Okay, so this is what we call as a chocolate cyst. If the lady has of this cyst is greater than 4 centimeters, then we won't be doing any medical treatment. We'll just straight away go through this surgical management and we'll